Hello, everyone. Hey, Ronald. Hey, Janet. Welcome to Wellness Wednesday. I'm very excited about this Wellness Wednesday today. I have one of my dearest old friends on here, Derek Satchell. Before I introduce him, though, properly, I just want to tell everyone thank you. I have reached 100 subscribers. Yay! I'm so excited. So, for all of you that have subscribed, I thank each and every one of you. Thank you so much. I look forward to growing this channel, but I need your support and I truly appreciate it. So, thank you. All right. So, Derek is a really good friend of mine. We met way back in college many years ago. We won't say how many years ago. And then we lost touch with each other for a little bit. And then that's one of the best things about social media is Facebook at that time had brought us back together. And now he's out here.
Find you.
What's that?
People find you.
Yes. When you don't want to be found.
No,
I'm kidding. So one aspect of Wellness Wednesday that I wanted to share with everyone is that it's, I know a lot of the couple of guests that I've had on was spiritual related, but wellness is a more rounder thing, right? It's dealing with mind, body, and spirit. So now I want to get a little bit more of these next couple of guests, Derek and another guest I have lined up. I want to talk a little bit more about body. And one of the things that I love to do for my body is to get a massage. And Derek is a certified massage therapist. And I'm sure you're thinking, oh, Sonia, that's great. You got a friend that does massages. Well, let me tell you.
Now listen, we're going to play nice.
Have you ever seen that episode of Seinfeld where Jerry hooks up with this girl and she's a massage therapist and she never gives him a massage but gives everybody else a massage? That's what I experience. He refuses to give me a massage, but I get it. I totally get it.
No. It's just because of where we're located. You are in LA and I am not. So,
well, and because once he did try to give me a massage and he was like, what the heck is going on there?
That's true. That is true. You are very tight.
Yes, I am. Boulders, I believe, was the word that you used. So I understand. He's like, I need these to work with. You are not killing my fingers.
But one of these days, we are going to have to get you on a table and do it right.
Yeah.
And I would love to have you come down and to my spa and to have a service. And one of these days, we're just going to have to find time to do it.
All right. I love that. Hey, Bonnie, welcome. So happy to see you here. Okay. So Derek, I'm going to let you go ahead and introduce yourself, tell a little bit about yourself, and then go in and tell us what is massage and tell us a little bit more about it.
Okay. Well, first, let me say thank you very much. It is a pleasure and an honor to be with you on your podcast. As you said earlier, we have known each other, it seems like forever. We hail from the same city, Rochester, New York, and we even attended the same undergraduate school, Hampton University. Whoop, whoop. So it has just been a pleasure knowing you and being able to reconnect with you, especially since I've moved or relocated out to the West Coast. So again, thank you for allowing me this opportunity to speak with you. Absolutely. And thank you, those who have logged in so far, and hopefully more will join us. I thank you for taking your time to hear what I have to say. I am hardly an expert in the field of massage therapy, but I am practitioner, and I have opinions and suggestions, and I hope that the information that I share with you all will be helpful. So, having said that, a little bit about myself. As Sonia mentioned, I am a CMT, a certified massage therapist, and that is the title that is bestowed to me by the state of California. Every state has different requirements, and I can go into that in just a moment. And based on those requirements, the title may be different. In California, they're called certified massage therapists. In Texas, for instance, it's licensed massage therapist. So it may vary, but for myself, I have been practicing massage and I've been a licensed massage therapist for about 19 years.
It's been 19 years already?
19 years.
Wow.
Yes. And the basis of my foundation, educational background, I received my initial license in Houston, Texas. It was called the Accutech Massage Therapy School and Clinic. The director was Katie Spangler. And what made her particular school and clinic so interesting and beneficial for me is that being Japanese in terms of her ethnicity and heritage, she grew up, her father was a master Reiki practitioner. And so she grew up in a very holistic, health-minded household. And so when she decided to open up a school and teach massage therapy, she incorporated touch therapy and stressed the importance of touch therapy, especially blending the Eastern and Western approaches to massage together, which I think provided her students a very balanced and well-rounded approach to massage therapy. And I can talk about the differences between Eastern and Western massage in a moment, but that's the basis of or foundation of my education. Since then, and since moving to California, I've had the pleasure of studying and extending my education, studying at IPSB, which is or was formerly known as the International Professional School of Body Work. I also studied at the School of Healing Arts here in San Diego as well, along with National College of Holistic Studies. And through those various institutions, I've been honored to learn from people who I think are masters in their field, at least locally. Mm-hmm. And I would be remiss to mention certain individuals like Hugo Anguiano, who was a master at touch therapy and body reading, which is very important in massage therapy and client assessment. Let's see, John Economos, who was absolutely amazing and thorough in deep tissue and so many other modalities of massage. My hat also goes off to Jeff Wersland. Jeff, in particular, who I studied under at the International College of Holistic Studies here in San Diego, he also works directly with the San Diego Sockers, which is the American professional soccer team here in San Diego. And I had an opportunity under him to work directly with them. So I've worked at massage at very different levels and acquired, I think, a unique educational perspective on it. So I'm extremely grateful.
Look, I didn't even know you did all of that stuff. I'm sitting here like, wow. Now, I'm just quickly curious to ask about when you're doing the body reading, is that something that's more, well, I'm sure it involves in being intuitive in trying to, when working with bodies, but is it more of a technique or is it more of you using your intuition?
It's funny you should ask that. Massage therapy, and that leads into a commonly asked question that I get. What does it take to become a massage therapist, and especially a good massage therapist? And if you go into massage therapy looking to make money, or simply because you like people, then you may not be very successful. Uh, a good or sound massage therapist obviously has to have a firm understanding of the basics of human anatomy, physiology, has to have years of hands-on experience with touch and massage, should be exposed to other cultures, other modalities and techniques through erudition, by traveling and getting massages from other people, especially those who know other techniques, so that you can expand your own knowledge of massage therapy. But there are 5 particular qualities that an individual, I think, really must possess in order to be effective. And that is obviously a passion for wanting to help people. You really have to have that deep in your core. Secondly, you have to have, like you said, intuition. Mm-hmm. Intuition in terms of a sixth sense type knowledge of what you're feeling, what you sense the other person, what their needs may be, and also intuition from observation, which goes back to your question of body reading. I can hear what you're telling me. Oh, my back hurts and I want you to work on my back. But if you're standing in front of me and your head and neck is like this, then that shoulder hike and that neck crick might be contributing, or what's contributing to your back pain. Mm-hmm. So it's through visual observation, in addition to client intake and that questioning aspect of the session, where I can detail or tailor what it is that I need to do in order to be most effective for you.
I was about to say, if they come in like this, then they might need an exorcism too.
Well, I've encountered that too. And then just quickly, the others would be stamina. Obviously, you're going to be standing for long periods of time. Dexterity. You've got to be flexible physically to be able to move from one position to another easily. But also you need to be versatile, because massage therapy isn't just about the use of your fingers. It's the use of all of the tools in your bag. Hence, I could use my fingers, my knuckles, my fist, my palm, side of my hand, my forearm. And based on what I see and the issues that I'm confronted with, although I may have a recipe of how I intend to work, I may have to alter that or modify that based on your size, your physical stature, where the problem is, and the size of the tools and the effectiveness of the tools that I have to work with. So,
okay. Perfect. Excuse me, you mentioned a little bit about the difference, or is that a little bit later to talk about, between Eastern and Western ways?
Yes. Massage therapy, and bear with me, if you will, with a little historical background. Massage therapy.
I need to grab my pillow.
Yeah. Mm-hmm.
Everyone, just so you know, I can preface, I promised Derek that I'll try to behave, but we have this, we have a tendency to act up a little bit sometimes. Yeah. Yes. So he knows I'm joking. We love each other, but
I know. No, massage therapy, dates back to prehistoric times. I think, in fact, it's Dr. Susan Salvo whose book, I referenced or maybe included in the link for the this this podcast. In one of her books, she mentions that there are prehistoric cave drawings that depict early man using massage techniques to cast out spirits, to aid and abet illness, injury, and so forth. So massage has been around since the dawn of time to some extent. We can also trace it back to the ancient Egyptians in ancient papyrus drawings and in their hieroglyphics. They demonstrate the use of early forms of reflexology, which is interesting. That's carried forward with the Greeks and the Romans. They used an early form of massage called friction rubbing, which was promoted by Hippocrates. Hippocrates. So it's been around forever, and the benefits of healing touch, human touch, has been around forever. Eastern and Western modality is how massage can basically be broken down today in these two paths, primarily. Eastern massage is based on Eastern medicine, and that's commonly found with your East Asian modalities or Asian medicine. And that's where there's a concentration on the application of touch based on energy channels, energy lines, and pressure points that are mapped out on the body. And that type of holistic approach to health. Some examples or modalities of that style would be Tuina in ancient Chinese medicine, where you use your finger, hands, knuckles, limb with this rolling type of pressure along the body. And then in ancient Japanese form of massage, there's ama, which eventually evolved into what we now know as shiatsu, where, again, using specific energy lines on the body, you apply this finger point pressure. So with Eastern approach, the sense of massage is more proactive. You're doing you're using herbs, spices, aromatherapy, you're using massage to maintain wellness and to prevent illness or disease, if you will. And with Western, it's slightly different. Western massage is based primarily on human anatomy, the physiology of the human body, muscles, soft tissue, joints, how the body moves in space, and various strokes that can be used to address the physical aspects and the physiology of the human body. So that's and with Western massage, it tends to be more prescriptive. Oh, I've injured my shoulder or strained a muscle, so I'm going to now use massage techniques on that joint for passive movement, or massage strokes like effleurage, friction, to help alleviate the pain or induce relaxation. So you've got, presumptive or preemptive, I should say, approach to medicine and prescriptive approach to medicine. So that's primarily the difference between Eastern and Western approach. Some people, might I add, think that they're opposing in terms of this approach to medicine, but actually they work very well in conjunction with one another, as long as you recognize Eastern is more proactive and Western is more prescriptive. Okay. Does that make sense?
That makes sense. And see, Ron, I was going to behave. So Derek, this is not me. Somebody brought this up. Ron said friction oil.
Friction oil.
Which got my mind going. I was like, okay, now I know there's other kinds of massages, so do tell.
Yes, yes.
No, most commonly too, I know a lot of people, there's like tantra massage, there's yoni massage, there's all different types of massages that people can do that benefit the body.
Absolutely, absolutely, and all of them have their respective role in the health and wellness of the human body. Uh, Typically, and in the most general sense, without going into too much detail, overwhelming detail, Swedish is what's commonly referred to as your general relaxation type massage. Long flowing strokes, medium to light pressure, and the primary intention is to induce relaxation. Deep tissue is typically used to address chronic pain, reoccurring pain, injuries, things like that. Yes, and that chronic pain may come from repetitive behavior, carrying a bag on the same shoulder for 40 years, or if you're an athlete, playing repetitively and practicing repetitively based on the type of sport that you're involved with, then you may want a deep tissue. The misnomer with deep tissue is that people think that you're going to go in with your elbow or it's going to be very deep or very painful. Yes, it can be, and most typically it is, because most of those problems typically lie deeper within the stratus of the body, because you have the outermost layer, the skin, the fascia, different layers of fascia, the muscles, all the way down, deeper lying muscles closer to the bone, and so forth. So you may need to use more pressure to get down to those lower areas. But deep tissue could also be lighter in pressure if you're working and trying to alleviate tension and problems at a more superficial level. So my point is, deep tissue isn't necessarily limited to just that really deep penetrative work. Other modalities, as you mentioned, could be Thai massage. That incorporates a lot of stretching, pinning and stretching of the limbs to help elongate the muscles to alleviate tension and pain. Historically, Thai massage is done on a mat on the floor, but in Western massage, it's been modified to be done on a massage table now, and it can be just as effective in a lot of ways.
I got it done in Thailand, and I swear they put me into a pretzel.
But it feels so good.
It felt incredible. And I mean, the prices over there, what did I pay? Like $10 or something like that for a massage? It was like, oh my God, it was crazy. Crazy
Absolutely.
good.
Absolutely. So that's one of many modalities. There's hot stone, when you want the use of heat to penetrate and help induce relaxation, but also vasodilate blood vessels so that blood can come in, fresh blood can come into the muscle areas that you're working. There is also, again, Tantra massage as well. Now, with Tantra, a lot of people associate that with sex. Oh my God, that's just sexual massage. That's all it is. And that couldn't be the furthest thing from the truth. Tantra involves, well, first of all, Tantra in Sanskrit means to weave or woven. And so the approach or intention of Tantra is to weave or incorporate the spiritual with the physical. And so in doing so, the individual through various breathing techniques and physical techniques, can get a better understanding of themselves, what they like, what they don't like, who they are, as it relates to their physical and spiritual awareness. And then there's varying degrees beneath that umbrella, like you say, yoni, that deals specifically with the female anatomy and reproductive areas, genitals. And then there's like lingam massage that deals with the man's genitals. So there's varying degrees and benefits of massage. There's, I think, if I'm not mistaken, over 300 modalities
Oh,
that a
wow.
massage, yeah,
I didn't realize there was that many.
over at least 300 modalities of massage that's practiced globally, worldwide.
Wow.
And so everyone has its purpose. The important thing when we go to get massages, you and I, everyone who's listening, that you know your intent. What is it that you are trying to achieve through your massage session, and that you communicate that with your provider so that you know they're capable of doing it, you feel comfortable doing it with them, and that they are able to accommodate you in order for your service to be effective.
Mm-hmm. And just so that everyone knows that the legitimate places, there are no happy ending massages.
Oh, well.
Most of the legitimate ones.
Well, again, legitimate is
Let's define the legitimate, right?
yes, exactly. Legitimate is defined as professional. And
Yes.
a professional massage is someone who is trained in that particular modality of treatment, whether they are certified by the state or local governmental authority, or they've been trained by a teacher or in a particular culture or setting to learn that modality. They are a professional in administering that service. It's interesting because you can be, at least in the state of California, you can be a holistic health practitioner that incorporates aspects of tantra, yoni, lingam massage, if again you are recognized as a holistic health practitioner, and that as a holistic health practitioner, I've established a health regimen routine that you and I agree upon as client and provider. That is completely legitimate, and therefore I am able to touch with mutual consent in your genital area if necessary, to whatever varying degrees. However, if the intent is solely to get you off or have some sort of a sexual release, then yeah, that's not a professional.
Yeah, yeah.
That's not a professional massage.
So, can you give me the name of those places that offer? No, I'm kidding.
You nasty.
I'm just saying, just in case somebody.
A
I have
mess.
to make sure that I have the information so I can provide to them.
You're a mess. You're a mess. Well, you're not going to hear it from me.
Yeah.
And I don't provide that service. Thank you.
Yes, let's get that clear. And I know a little bit you're going to take us through as far as what someone needs to do to prep for a massage if they haven't had one before, so that they know what they should do for that. So tell us, like, what are the requirements for someone that wants to become a massage therapist?
Well, as I mentioned earlier, if you want to be a massage therapist, you have to know or have a good understanding of yourself. Do I possess the empathy, the intuition, Am I an effective communicator to not only understand what the guest wants or what their expectations are of me, but can I also use visual cues and verbal cues to interpret what it is that I may have to do that they may not even be aware of? Like I mentioned, you could be saying, oh, it's the pain in my back, but they don't even realize that their shoulder's up here. So, and that could be contributing to the pain that they're experiencing. So, again, communication is key. Stamina, you're standing on your legs for hours and you're walking. So if you have a problem being able to perform services for lengths of period like 5, 6, 7, 8 hours straight, then this career may not be for you. And then lastly, as I mentioned earlier, having a sense of dedication and passion. But if you are comfortable with those things and you feel that you possess those traits, then obviously you'll need to go to school and receive training. In the United States, that training varies from state to state. In California, in order to become a certified massage therapist, you need at least a minimum of 500 classroom hours of instruction on things like anatomy, physiology, hydrotherapy, ethics, things of that, professional business. You'll need to know those things, and they'll teach you those things. You also need hands-on training. Most schools offer this hands-on training as part of their coursework. But then some schools, such as the one I attended in Houston, have an internship requirement where you have to work in their clinic and have to perform a certain number of hours actually performing the massages you've learned on paying clients in order to get the hands-on experience that you need. So that's the second thing. Practical experience, as I mentioned, once you've completed your classroom training, your hands-on training at your school, that's when the massage and your learning really grows, because it's one thing to learn what different physical conditions that you might encounter, but it's a completely different one when you actually work on people, because everyone's different. You work on pregnant women who are in their early part of their first trimester, which physically they may be completely different in size and issues that they're dealing with compared to someone in their later stages of their third trimester. You might encounter issues like kyphosis, a rounding of the upper back, upper cross syndrome, where it's a forward neck positioning and you've got to try to work with them to help alleviate or address physical aspects like that. So your practical experience only comes with the length of time and the longer you're in the profession. And then last but not least, again, exposure, erudition. You need to get out and learn other modalities from other therapists of other backgrounds and cultures and regional and geographic locations, because that's where you can then cull aspects of other people's recipes and others' techniques to enhance your own. So, yeah.
Okay. Do you want to go into, is there something else you want to share about massage before you went into about how to find a masseuse and prepping for all of that and all that good stuff?
Absolutely. Excuse me. Absolutely. I just want to mention that massage therapy is not limited to just working as an independent contractor or independent therapist on people, meaning having your own business. There are varying ways in which you can administer massage, as well as related professions that are associated with massage. In terms of administering massage itself, and then or sole proprietor of your own business and work for yourself. You could work for a day spa, like a Massage Envy or a local massage establishment. You could work for a large hotel or a destination resort. You could work as a massage therapist for the cruise industry. I know right now the cruise industry is almost completely shut down, but I anticipate that once restrictions are lifted and people begin to travel more, the demand for massage therapy at sea is going to increase, as I'm seeing business coming back or returning to local day spas and hotels and resorts. Associated professions with massage, you could go into massage and then realize, you know what, I don't want to work with manual manipulation of the body. I want to work with acupuncture. I want to deal with energy. I want to be a Reiki healer. I want to, and you're familiar with Reiki and you're familiar with that. Or I want to be a physical therapist. I want to be a personal trainer. So just because you receive training in massage therapy doesn't limit you to being a body worker, is what I'm getting at. Yeah. But in choosing a profession in massage as a therapist, there are certain pros and cons that individuals need to be aware of. Pros, obviously, you're surrounded in a beautiful, tranquil environment. It smells wonderful. People love to see you. They're happy when hopefully, they're happy when they leave you. But the cons are, or some of the challenges, I should say, with being a massage therapist is it takes you a while to establish yourself. And to establish a clientele. So the money may not be immediate. Depending on where you live and where you're working, you might start out making like $25,000 a year, $25,000 a year. But the longer you're in it, the more successful you are. And depending on where you work, let's say you may be able to make as much as 60, 70, 80,000 a year. That might be someone like in a New York or San Francisco, as opposed to maybe a 30,000, 50,000 a year for someone working like a Billings, Montana or something like that. So you have to keep that in mind. One of the most important things to know, especially as a male going into this profession, is that there is a gender inequity. And when I say inequity, I don't mean inequality, because men and women both work in the field and can be both successful at it. There's just an inequity because our society for years have been conditioned to believe that women should be massage therapists. I don't know if they think women are more nurturing than men. I don't know if it's primarily because of the gender issue. Most men are uncomfortable having another man touch them, or some women are uncomfortable having a man touch them as well. So those are definitely challenges when it comes to gender. But the advantage to that is that women, even though there's more women in the profession, they tend to burn out faster because they're being used more and they're working more. So the competition among women within the field is higher. Also, again, men can be successful if we can convey and instill a sense of trust in their guests. That's the key. If I am extremely professional in my approach, I'm extremely diligent in my draping so that a guest, whether it's male or female, does not feel insecure about being exposed. Um, if I'm attentive and listen to what their needs are and effective in my approach, then regardless of how many women are in the profession, a man can be just as successful, if not more so, than a woman. So that's gender is definitely something that an individual should keep in mind too. Having said that, though, I feel compelled to share with you an insight that was recently brought to my attention as I was planning to speak with you today. I met with one of my female clients, and I asked her, I said, for years we've been working together, and you have now an established preference for a male therapist. Is there a particular reason why? And what are the reasons why you have a preference for male therapists? And I've not only asked her, but I've asked a lot of other female guests and clients that I've had. And surprisingly, it's not strength. You would think they would say, oh, well, men are stronger than women. And that's obviously not the case, because I know several therapists who are female who are much smaller in stature than me, and they can have me screaming on the ceiling. And I'm much bigger than them. So it's not strength. That really comes from your body mechanics and using your body leverage to provide that pressure. But what I found is that they say it tends to be the size of their hands. Men typically have larger hands than female therapists. And for that reason, or for many reasons attributed to that, I've had women say, because they have larger hands, I feel more secure. Because they have larger hands, I feel that they're more effective with the surface area of the tool that they're using on my body, be it a fist, a palm, their forearm. Because of the size of their arm, it tends to work better for them. So surprisingly, it's not strength. I just thought that was interesting. I wanted to share.
Well, it's so funny that you mentioned that, because for me, it doesn't matter, male or female, long as they have, boulders here. So I need someone that can really get in there. But there was this guy once that I had, and I think I told you this before, and he had these like little stubby fingers. And I was like, oh, what's he going to do with that? Like, I mean, like, they were like really tiny little hands and like just like nubs, really. As soon as he got in there, I was like, oh, what fingers? I was like, whatever, do whatever. I don't care.
Yeah. And again, it's not to say that you have to have monstrous hands in order to be effective or fingers to be effective. I just thought that was an interesting and unexpected response from the several women that I spoke to. But again, when it comes to being effective, listening to what the needs of the guests are, what their intention is, what their expectations are, addressing those during the service, and being effective in utilizing the appropriate tools that you have. Again, finger, knuckle, fist, palm, hand, forearm, based on what it is that you're doing and where you're working on the body. That's what's going to give a particular therapist or provider the advantage of being successful.
Yeah. Lisa. She said little paws. That's exactly what he had, little paws. But he knew how to work those little paws. So,
Hey.
so there's I know that we have someone here on here that's never had a massage done
Mm,
before. I know when I first had a first massage, I didn't know what to do. Nobody told me. Like, I was like, do I go in? Do I get totally naked? Do I leave something on? Like, what do you do? So if someone is deciding to venture out and test it out a little bit, what are your suggestions? What is the process normally for people?
right, right. And those are excellent questions. Even when I went to massage school, I didn't really know or learn, or no one really told me any of this, in spite of having massages prior to going to massage school. No one really told me specific things that I should look for, and things that I should do prior, during, and after my treatment. And that's part of what I wanted to talk to you today. So that's an apropos question. Um, First is obviously finding a therapist that's going to be right for you and the right fit. Uh, the first thing you should do is decide where you want to have a massage. Do I want to have it in my own home? And there's reasons for that, because after it's done, I'm home. I don't have to worry about driving anywhere, dressing, doing anything. I can just relax and that person leaves. But one of the concerns with that is, how do I feel inviting a stranger into my house or my office or hotel room to do this? So, and what's the practicality of it? I'm on a business trip, or I'm at home, or I'm in a remote location. There aren't any people who are available to do an out call like that. So that's the first thing you need to consider in choosing or finding a therapist for yourself. The other thing would be, what is your intention? And that's the big thing. Do I want to relax? Do I want to address this pain or chronic issue that I'm dealing with? Do I want to alleviate tension? Do I want a new experience? What is your intention? And that's where you need to know up front what it is that you want, because that will then enable you to communicate to your provider what it is that you want to get out of this service. Okay. So know what it is that you want, or have an idea of what it is that you want. Then obviously you're going to want to look for, is this person experienced? What is their level or degree of expertise? That doesn't necessarily guarantee that you're going to get an excellent massage. That may strengthen the option of you getting a better massage. But when I say knowledge and expertise, that goes back to what I mentioned earlier. You can get a student fresh out of school that knows all this information, but with the lack of practical experience, they are unable to meet your needs or your expectations. But someone who has been practicing for 30 years, but may not be as versed in the technical knowledge that someone fresh out of school has just retained, uh, may be completely different, or may give you a completely different experience. So again, it's not a guarantee, but obviously experience, knowledge in massage help, word of mouth, uh, references from other people, or hearing, oh my gosh, I went to Sonia and she was fantastic. If you ever need a massage, you've got to go to her. That clearly works. And then obviously, as I mentioned earlier, issues with trust, being comfortable with the individual, how effective they are when they do the massage. Those are also other aspects that come into play that you need to consider when choosing a therapist for you.
Mm-hmm.
But having said all that, let's say you found a person, you're going to go, let's say, there to their location, their establishment. You want a Swedish massage. What is it that I need to know ahead of time to prepare to help ensure that I get the best type of massage that I'm looking for my money. And there are specific things that I would strongly recommend. First, be sure to schedule your appointment in advance. That's the most preferred. We all get busy. We all have a million different things to do. But if you can schedule your appointment in advance, and if things change, then there's a time or an opportunity for you to cancel or reschedule without possibly getting charged for it. So give yourself time in advance to set up that appointment. Again, as I mentioned before, have an intention. What do I want to accomplish? Relaxation, pain management, relief of tension, and so forth. Know what type of modalities are best suited for what your intentions are. Swedish is relaxation, deep tissue is for addressing pain. If you're unfamiliar with a type of service or modality a spa offers, like Lomi Lomi or Thai, don't be afraid to do your homework and ask questions ahead of time. Hey, what does this encompass? How is this different from what I'm familiar with? You might be pleasantly surprised by what this other modality might be able to offer you. Okay. Obviously, you want to arrive early to wherever the establishment is. This is good for a number of things. A, it gives you an opportunity to relax, to exhale. That's part of the decompressing that you need to do to prepare to receive your massage. It allows you time to go to the restroom, to shower in preparation for your service, to familiarize yourself with the establishment, the amenities that are available. So definitely arrive early. One of my biggest pet peeves as a practitioner is when someone has a massage scheduled for 9 a.m. and they arrive at 8:59. You're already like this, you're rushing, you're anxious because you're late. In doing so, you've just made it that much more difficult for me in the allotted time that I have to work with you to get you to relax.
Yeah. Yeah.
So it's in your best interest to arrive early. And a couple of last things that aren't necessarily mentioned frequently. You want to dress comfortably for your massage. I know everyone wants to look good. They want to look stylish. They've got the Ferragamo pumps. They've got their couture clothes. You know what I'm saying? And that's great. That's great.
Yeah, no, I'm more of a flip-flop sweatshirts and like, let's do this. I don't have time for all that.
Good.
No
And
makeup. No.
good. And that is what you should do, because after you've received your massage, you're in this heightened state of relaxation. The last thing you want to do is put on something that's tight, constricting. You know what I'm saying? So you want to be comfortable. So dress comfortably when you go to your service. Last but not least, should I be naked for the service? Should I prepare to be naked? What I always tell my clients is disrobe to your comfort level. But there's a caveat to that. When I say disrobe to your comfort level, you can be naked because you're going to be draped at all times in terms of your genitals, your breast as a female. You're going to be covered. So there's no risk of exposure. However, if for whatever reason you feel more comfortable leaving your bikini bottoms on or panties on, or gentlemen, if you want to leave your shorts on, by all means, most providers, most therapists are versed where we can work around those things. Just know that the degree of clothing in which you retain may or may not affect the continuity of your service. And what that means is if I'm using a modality like Lomi Lomi, where I'm using long flowing strokes, where I can start at your neck and in one continuous stroke end up at your feet and come back up, I'm better able to do that if you have no shorts on, no underwear on. You're still draped, but I have access to your body. If I have to stop and start because of shorts, because of bra straps, things of that nature, then that's only going to lessen the effect for you. So disrobe to your comfort level, but know the best, I think, in my professional opinion, is to be nude because that allows the therapist to have greater access to the body.
Ron says he doesn't wear bikini.
Hopefully not, Ron. But if you do, that's okay. There's nothing wrong with that. Some people prefer it. But one other thing, if I may add, is two things that just absolutely irk me as a therapist, and I'm sure others who hear this may agree. I don't care if your legs are shaved, ladies. If I can massage a 400-pound hairy man, the hair stubbles on your legs isn't going to mean anything to me. I don't care. And then the other thing is, please, please remove all jewelry.
Yeah.
Necklaces, big ostentatious rings, toe rings, belly chains, all of that is an obstacle or can be an obstacle for me as a provider. You may damage the necklace or ring or whatever with the oil from your body or from the workings of the massage may damage your jewelry, and you may lose it. If you come into the treatment room and you put all this jewelry in your robe pocket, and then when you're ready to leave, you toss the robe in the bin with the other dirty linen, guess what? Your diamond ring is buried in the hundreds of other robes and may not be retrievable. So remove your jewelry before you even take your clothes off. Leave it in the locker where it's secure. And that way, no one has to worry about things like that and phones. Just leave it in the locker.
Yeah. I know I have belly beads, and I know that has been an obstacle, but mine are not removable. So I have worked with people. They've been really good with working around it, but I know it is an obstacle. And sometimes I'm just kind of like, oh, I wish these could come off. But
and again, there are circumstances where they can't, and that's fine. But I'm talking about the superficial where, I had one woman come in and she looked like Mr. T. She had so many chains and necklaces and neck braces and chokers.
Wow.
It was gorgeous, but it was just too much. And in addition to the possibility of that getting lost or damaged, removing all of that stuff during your session takes away time that I have to actually have hands-on with you.
I mean, why would you want that when you really want someone to get into your neck? Like, I mean, I would take off all my rings because I want someone to really get in and massage my hands and feel. Lisa said, "I pity the fool."
Absolutely. But again, it goes back to arriving early.
Mm-hmm.
9 times out of 10, when I encounter someone with all this extraneous stuff on, the first thing out their mouth is, "Oh, I forgot to take it off." Well, if you arrived a little earlier, you may have remembered. You could have taken care of all of that, and we wouldn't waste treatment time on you removing and replacing this jewelry. Mm-hmm. So that's just something to keep in mind.
I know another thing that I found, that there are different places that have like I've been at some places where leaving your underwear on or off is optional. I've had other places that prefer that you leave your underwear on. And I remember the first time where I went without was when I was in Bali. I had a massage done, and the little lady, she was like, take it off. And I'm like, uh, oh, okay. And not that I had a problem with it, because it, like, as Derek mentioned, you have to be comfortable with what you're doing. You don't want to put yourself in a position if it doesn't feel right to you, because you're not going to enjoy your massage, and that's the last thing that you want, is to feel a certain kind of way and be in there. You're not going to relax. You're going to be tense. So if that's not for you, then don't do it. But there's different places, and these are all the different types of questions you want to ask ahead of time when you're making that appointment. Do you require for me to wear my underwear, or do I have to take my underwear off? Ask all these questions to the point that, and they're used to all these questions. So ask all these questions so that you are comfortable with what you're hearing, and that this is what you want for you. But let me tell you, this little woman, like, when I say she went in, she went in.
Oh,
I was like,
absolutely. Absolutely.
we need to, like,
Absolutely.
should I propose to her or what?
Oh, well, wait a minute. How good was she? Where was this?
There's some uncharted territories there. I was like, okay. Yeah, I was like, this is very different than what we do in the States. So, but no, again, she was it was very professional. It's just,
Right.
That's just how they do massage. And she just got into everything, and she was really, really good with
Right.
just massaging the body.
Right. And that that difference is primarily cultural. You'll find that in most cases, the Eastern hemisphere, the Eastern part of the world, they are much lax when it comes to nudity.
Mm-hmm.
They're more comfortable with nakedness, if you will. Um, and even in the United States, there is a certain degree of comfort with working with greater exposure on the body. Case in point is what I mentioned earlier, Lomi. Lomi is a modality of massage that is Hawaiian or Polynesian,
Mm-hmm.
where they use primarily the hand, known as the kahi, and the forearm, which is kahua. And it's like this weaving motion all across the body. In sacred Lomi, you are naked on a table, and the only covering is a hand towel folded in half that might cover your gluteal cleft, and then when you turn over, you're completely naked or topless if you're a woman. And I've had that type of massage, and it is absolutely transformative. It's transcendental. It's just amazing. Um, However, where I work, we offer Lomi, but obviously for liability purposes, we can't do sacred Lomi with that degree of exposure. So we utilize what's known as a resort style draping, where we work segmentally over the body. In other words, I'll do your back, redrape, I'll do a leg, redrape, or I may undrape one half of the body and do that long flowing stroke. But in terms of the degree of exposure in sacred Lomi, obviously we don't do that. So yes, you're right. Talk to the establishment ahead of time, learn, do your homework, find out the treatments that they offer and how what they offer best relates to what your intentions and expectations are for your service.
And what does someone do during a session that they're not enjoying something, or if they're not comfortable with something. A lot of times people think once they get up on that table, they're supposed to keep quiet and just let what happens. What are your suggestions and thoughts on that?
Well, and you're absolutely right. And I felt the same way when I first started getting massage before I even went into massage as a profession. But what I've learned and what I tell my guests is that this is your session. I am here to meet your expectations and your intentions. So, although the room may be dimly lit and there's soft music playing and candles, and the room is an ambient temperature, if you feel more comfortable with no music, or you want the lights raised, or you want you want to work in a completely dark room with no light, if you want the temperature high on the table or low, that is your prerogative, because this is your service. The way the ambience of the room is set at a general setting for most people, but you control the ambiance, you control the degree of interaction. Because I'll tell you this, I obviously have a preference. My preference is that you don't say anything. And I say that because while you're laying there relaxing and I'm doing the recipe that I feel is going to be most effective to meet your needs, I'm concentrating. So I'm reading through the sensations of my tools, how much pressure to use, where to draw back, what muscles to target. So I'm in my head. So I need to concentrate. And talking for me is a challenge, especially if you're asking me difficult questions. So, what's the square root of, XY933, or, why is the sky blue? I can't do that well. It comes out, or it comes across very awkwardly. So for me, it's best to work in silence. But I can talk. When it comes to talking, your therapist, if they're seasoned and they're worth their salt, they will take cues from you. If you get in there and you chat, and that's fine. And then once you're on the table, if you go silent, then 9 times out of 10, they'll be silent.
Yeah, I
If
had
you're
a therapist
talking,
that never took that cue once, and she would go on and on, and I'm like,
I know.
Be quiet so I can enjoy my massage.
Well, in that particular case, then it is completely appropriate for you to say, excuse me, if you don't mind, I would like to enjoy my session in silence. That's fine. We are working to achieve your expectations. So that's fine. Sleeping is another thing. I've had people tell me, oh my God, I don't want to fall asleep. I want to be aware of what you're doing, and, I want to feel good. Well, sleeping and falling asleep is the greatest compliment you can give a therapist, because what is sleep? The most highest state of relaxation. And if I can get you to fall under certain circumstances, i.e., if you're there for a relaxation massage and you fall asleep, that only means that I've achieved my goal, but you trust me because you've allowed yourself to reach that state of relaxation. Now, if you're there for deep tissue and I'm standing on your back and you can fall asleep, more power to you. And I've had that too. So again, this is your session. You do what you want. Feedback is extremely important. And when I say feedback, a therapist worth their weight and their expertise will say, we'll check in with you. How's the pressure? They'll work. They may turn you over. How's this pressure? there'll be an occasional feedback to make sure that they're working within the range, the pain threshold that is necessary or expected. Moaning is also instructive and positive feedback. But if you're moaning to the point where it could be interpreted as suggestive, then that may be a bit much. That may be problematic. So,
Okay. I want to make sure that we address questions that come
please.
in. So if anyone has any questions, please go ahead and put them in. I know Jay had joined us a little late, so he did miss out on you talking about becoming a massage therapist, kind of the steps and all of that. So I told him to go back and check because he says that my friends say I'm really good at massaging them and some of them pass out sleeping. So Jay, sign me up for a massage
Watch
because
out, Jay. Boulders on her back.
I'm looking for someone that will take my case.
I'm just saying.
Bonnie, if you're still on, I know you had a question. You can go ahead, unless it got answered. Great. God, it's hot in here. All this talk about massage, I'm like,
I know.
This is what happens when you're locked up in quarantine too long.
Well, I'm just saying. While you're trying to cool yourself off, allow me to address a couple of other issues during a session that people most commonly ask. One is bodily functions during a session. Obviously, if you have to cough or sneeze, the best thing to do is to turn your head away so that you're not obviously doing that directly in the line of path of the provider. You want to be respectful in that regard. But
and let me ask something quickly about that, if I may interject.
Please.
How is that being handled in this day and age of COVID?
Oh, thank you. Good question. As we start to come out of complete lockdown and massage therapists and establishments are receiving guests again, there are specific protocols in place to help ensure everyone's safety, whether it's the provider, the guest, and what have you. Every establishment is going to be slightly different depending on where they are in the country, the state, as well as the institution or the facility in which they are working. Speaking specifically for the resort that I work for, we have very stringent protocols in place. Guests, we are currently and still under a mask mandate, so guests are required to wear a mask while they are on property. The mask, they are able to remove the mask temporarily while they are face down on the table, provided that the face cradle, the part that you lay your face in, is fitted with a pillowcase. That acts as a sack or a bag to help contain any respiratory droplets that the guest may incur while they are face down. So you can wear the mask while you're doing that, or you can take the mask off temporarily, provided that there is a covering that prevents droplets from getting out. We take temperature of our guests as they come into the property. There is a HEPA hospital grade air filter in each of the rooms to help clean and sanitize the air. And obviously, anything that is touched, we clean and sanitize thoroughly between each session.
Okay.
So there, yes, we are receiving guests, and there are certain safety protocols in place to help ensure everyone's safety.
Okay.
Yeah.
And that's a good thing for anybody that is looking for a place to go for massage, to ask what are their COVID protocols, if that's something that's important to you. To ask them, do I need to wear a mask? Is the therapist wearing a mask? What are your cleaning techniques? Things of that nature. Again, this is all about your comfort. So you want to make sure that you have everything addressed to your needs. So you're going into that massage and you can feel nice and relaxed. And the question did come over, and I know I'm going to mess this up. I do
Oh,
know
yeah.
I'm familiar with fibromyalgia. Look, I can't even say it now.
Fibromyalgia.
Thank you.
Yes.
And she also says she has, I haven't heard this, ankylosing spondylitis. I don't know if you can see your comments, so you can see here. So
See.
I've never heard of that before. Bonnie, can you just explain a little bit what that is, just so that we both know? But she says that she needs a deep tissue massage, but is very ticklish to light touch, and
Mhm.
also has multiple pain trigger points. How can that be accomplished?
Well, again, it depends on the severity of her. If she has and has been formally diagnosed with fibromyalgia, it depends on the degree of sensitivity, obviously, of the body. Uh,
Here's a little another tip too, Derek. She says she has an implanted medical device on her sacral spine with a battery in the left hip.
okay, yeah. That is something that can be worked around depending on exactly what it is. I've had people with pumps for their pumps on their body with what do you call those? Oh my goodness, I'm at a loss for the word. The sacks for oh geez, for their waist.
Oh,
Um,
okay. I know what you're talking about.
I'm
A
sorry.
waist back. Yeah, I don't know
I,
what you
yeah, I forget the term. I'm at a loss, but yeah, there are obviously different things that we can certainly work around. Fibromyalgia, in particular, uh, that's interesting because recent studies are showing that it is a neurological condition that is based primarily in the hands that people are finding. And so that even though the sensation and the pins and needles and what they're feeling may be all over their body, if the hands can be massaged and addressed, that might aid or abet to a certain degree the sensation as a result of the fibromyalgia because they find that it's an overcompensation of nerve endings in the hands. That's one particular study that I found fairly recently, and it's quite interesting. But like with any medical condition, uh, I would strongly advise her or anyone else to speak with their doctor, obviously, prior to getting any sort of body work, because certain medical conditions are uh, contraindicative or not advised for massage. And then there are certain conditions that are indicative or are permitted, but there are certain precautions you have to utilize. Case in point with cancer patients. Obviously, if someone has cancer, depending on the type and the degree or the stage of the cancer, they may be able to receive massage, even if they're receiving, let's say, chemotherapy or chemotherapy or radiation. However, it depends on when they're receiving that chemo or the radiation. Uh, when they're receiving that is when it might be indicative for them to receive massage, because the last thing you want is to have someone to receive chemotherapy treatment, have that in their system, and then through massage, you're further exacerbating it by spreading it,
Mm.
with the use of your massage modality or technique. So again, whatever your medical condition is, speak to your doctor first. ask if massage is indicative or permitted, and then communicate your condition with your provider at the start or before your session.
Okay. Yeah, it was a colostomy bag.
Thank you. I should have known that. Yeah.
The other thing that I couldn't pronounce what she has was an inflammatory autoimmune disorder, arthritis of the spine,
Yeah.
essentially. So, yeah.
Yeah. And again, what we're finding as massage therapy as a profession evolves and matures and grows, we're getting a better understanding of the human body. And there's certain things that were once thought untreatable with massage therapy
Mhm.
is now can be remedied through appropriate touch and massage therapy. Um, Case in point, the dowager hump that you see, the large hump on the back of uh, most elderly people, or like I said, forward head upper cross syndrome, where because you're forward working on a laptop or computer, your neck is well beyond the axis of your spine, or kyphosis or scoliosis of the spine. We used to think that, oh, well, there's really nothing you can do with massage, but using the appropriate techniques of knowing which muscles are in tension and which muscles are weak, that help uh, um, uh, to reinforce that abnormality or curvature of the spine. By working the appropriate muscles in the appropriate way, you can help remedy that. So again, whatever your condition is, speak to your doctor, and they can tell you whether or not massage is appropriate, and how it can be used effectively.
Okay, great. I know we've gone a little longer than I normally do, but you know what? This has been fantastic. A lot of good information. I'll just wait to see if any other questions come in. But if you can just tell people what are the most important things that they should do after they have had their massage.
Oh my goodness. And that's definitely something that is commonly overlooked, because no one really just talks about it. You go in, you get your massage, it feels great, and then you're back in your clothes and you're on your way. And I understand that we all have busy schedules, but the most important thing to remember is that you have an intention when you get a massage, and especially if it's relaxation. After a massage, you want to do whatever you can within your power to maintain that state of zen, if you will. So if you're at a resort or a day spa or somewhere where you're receiving a massage and you have an opportunity to relax in their lounge quietly, to sit in a steam room, jacuzzi, an outside deck or terrace, do that. Relax. Allow your body to process what just happened, because you just incurred a physical encounter. So allow receive the massage and maintain that state of zen. Even if you have to leave and go home, try ways to incorporate maintaining that sense of zen. Dim the lights, listen to soft music, do whatever you can to alleviate, remove the stressors in life that will cause you to tense up. The other thing is drink plenty of water, obviously. The reason why many therapists encourage people to do that is to stay hydrated. When we massage, we increase circulation in the body. We're breaking up knots, if you will. We are helping the body process and eliminate waste, metabolic waste, so that when we're done, if you have a need to uh, uh, remove or eliminate waste, do so. And drinking plenty of water will help to flush the body of that metabolic waste. So you want to definitely rehydrate yourself. Another thing I would strongly recommend is don't eat a heavy meal after massage. Many people will experience a growling or grumbling in their stomach while they're getting a massage. That's a good thing because that indicates your circulatory system is working, blood is flowing to vital organs like your stomach, and your stomach's like, hey, we're getting blood, we must be about to eat, and so that's normal, that's natural, but don't eat a heavy meal because then you're going to be more prone to feeling bloated, sluggish afterwards. Eat a very light meal and allow, again, your body to process. And the most important thing is monitor your body's reaction to the massage and monitor your behavior. You want to monitor your reaction because if you have an allergic reaction to the aromatherapy, the type of oil that was used, you then know how to address it. If you're sore and you're more sore, or you're having pain that wasn't there prior to the service, then that's something you need to pay attention to. So monitor your reaction to the massage and then monitor your behavior. If your therapist has worked on you because your shoulder was up here and has now got your shoulder to release, don't get dressed and throw that heavy bag on your shoulder and walk out like this, because now what you're doing is counterproductive to what you just achieved. So be conscious of the repetitive behavior that you may be doing that contributes to the problems and the pain and the tension that you're experiencing. So those are the things I would strongly recommend.
Okay. So you mean it's not a good idea to eat a thing of beans before going for your massage?
Eat all the beans you want after. But if you don't have to, don't eat the beans before. If you do eat the beans and you pass gas, because flatulence is a natural body function, what I recommend is either one of two things. Don't say anything, because there's only two people in the room. And if the therapist knows he or she did not pass gas, guess who did it? So there's no point of bringing it up. Or if you're self-conscious, then just politely say, oh, excuse me, I'm sorry. 9 times out of 10, the therapist isn't even going to say anything, or they'll say, okay, and they'll move on.
See, us in the spiritual community, we would just say, oh, I'm so sorry. My guides can be a little rude sometimes.
Absolutely.
I haven't taught them any manners yet.
Listen, these things happen. It's the same. While we're on the subject, it's the same with erections. Most men are very self-conscious about getting touched. They're afraid they might experience an erection during a massage, regardless of who's administering the massage. And my response to them is, it's completely natural. Mm-hmm. As the massage is occurring, as you're moving blood from your head to your toes and from your toes back up to your heart, blood is going everywhere, and the blood is going to go there. Yeah. So if a gentleman incurs a semi or even a full erection, don't worry about it. Don't call attention to it. Just ignore it. It will eventually subside on its own. And I can almost guarantee you 9 times out of 10, there are enough blankets and things folded over that area where it may not even be visible if you don't call attention to it. So don't worry about it. It'll go away. Just focus on emptying your mind or being in the state of Zen that you are in.
Okay. I love it. Ron says channeling gas. And Bonnie said just reschedule your appointment if you have gas.
Absolutely, absolutely. And if you have to pass it, I'd rather you pass it and be comfortable for the rest of the service than to hold it and feel uncomfortable and unable to relax while I'm massaging. Now, will that therapist talk about you afterwards?
Oh, yeah, that's a good thing to talk with the team about. Hey, in the words of Shrek, better out than in. So there you go. All right. All right. So we're going to wrap this up. Derek, thank you so much for being here. I so appreciate you. Thank you. Thank you. Thank you.
Namaste. My pleasure.
Thank you, everyone who tuned in. If you didn't catch all of it, be sure to go back and check it out from the beginning. There's a lot of good gems discussed, and I thought we did pretty good, right? We behaved. I behaved. Um,
Yes, you did. And
I
I'm
did.
quite proud of you.
Yeah, I'm very proud of myself.
Because
So
this could have quickly gotten off the rails real fast. But I appreciate your degree of candor and professionalism.
yes, yes, yes. So yes, thank you again for everyone tuning in. And this Friday, I will be doing my oracle readings for Coffee Chat. So if you are around at 8:30 a.m. Pacific time, 11:30 a.m. Eastern time, be sure to tune in and join me. And yeah, thank you, everyone. Enjoy the rest of your Wednesday evening.
Thank you, Sonia. Thank you, everyone. Take care.
Take care.